BHU Nursing Officer Exam 2019 preparation video. There are 50 questions in this video. Welcome you all to Sathish 2.0 online nursing channel. Before seeing this video, if you are not a subscriber of Sathish 2.0 online nursing channel, please subscribe now. Also click the bell icon to get the latest notification of all our new videos. Let us see all the 50 questions one by one with the answers. The first question of this video is, while measuring the central venous pressure, the 0 point of manometer is adjusted to option A, anterior axillary line, option B, mid axillary line, C, posterior axillary line, option D, at shoulder level. So which is the right answer here? The right answer is option B, mid-axillary line. Question number 2. Included in teaching the client with tuberculosis taking isoniazid about follow-up home care, the nurse should emphasize that a laboratory appointment for which of the following lab test is critical? Option A, liver function, B, blood sugar, C, stomach cancer, and D, multiple myeloma. So when you take isoniazid for the treatment of tuberculosis, which laboratory appointment is which laboratory test is very significant during the follow-up care? The right answer is option A, liver function, because isoniazid can be hepatotoxic. Question number 3. What type of fracture is seen in this image? The type of fracture seen in this image. Option A, grade stick, B, spiral, C, compound, D, communator. The right answer is option D, communator. Question number 4. Cullen sign and Turner's sign are seen in option A, appendicitis, B, pancreatitis, C, cholelithiasis, option D, cholecystitis. These two signs are present in option B, pancreatitis. Question number 5. Ineffectual and painful straining for an extended time is known as option A, borbogymy, option B, constipation, option C, steatorrhea, and D, tenesmus. The right answer, option D, tenesmus. Move on to sixth question. The amount of salt present in a human body is option A, 1%, option B, 0.6%, option C, 0.4%, option D, 2%. The right answer, 0.4% salt is present in a human body. Seventh question. A spoon which looks bent is an example for which of these? Option A, reflection, B, refraction, C, focus, D, retention. The right answer, option B, refraction. Question number 8. Who propounded the homeopathic principle of like cure like? Homeopathic principle of like cure like. Option A, Hippocrates. Option B, Samuel Hahnemann. Option C, Samuel Cockburn. Option D, George Vithoulkas. The father of homeopathic medicine, who propounded the principle of like your like us? Option B, Samuel Hahnemann. Question number 9. The mass per unit volume is called A. Density, B. Force, C. Work, D. Pressure. The mass per unit volume is called option A. Density. Question number 10. Which of the following states in India has the highest area undergoes mangroves? Option A. Tamil Nadu, B. West Bengal, C. Odisha, D. Gujarat. So, in areas, which state has the highest mangroves forest? The right answer is option B. West Bengal. Question number 11. The three major spheres of learning, that is, cognitive domain, affective domain, and psychomotor domain, has been the child of which educationalist? Option A. Ralph Taylor, B. Bloom and Brown, C. Bloom and Simpson, option D. Edin Williams. The right answer, option C. Bloom and Simpson pointed out three domains in education like cognitive domain, affective domain, and psychomotor domain. Question number 12. The family planning device inserted within 48 hours of delivery is called option A. PPIUCD, that is postpartum intrauterine contraceptive device. Option B. IUD. Option C. IUCD. Option D. All the above. So from the question you get the answer. Inserted within 48 hours of delivery will be option A. Postpartum intrauterine contraceptive device. Question number 13. Refractive index of human lens at the center is option A 1.386, B 1.406, C 1.506, and D 1.486. The refractive index of human lens at the center will be option B 1.406. At periphery it will be 1.386, but at center it is 1.406. Question number 14. The patient with AIDS has a CD4 and T-cell count of 175 cubic millimeter per liter. The nurse is aware that option A, he is likely to be asymptomatic. Option B, he is relatively free of HIV. Option C, he is in remission with his disease. Option D, he is at risk for opportunistic infection. The right answer, the right answer is option D. The client whose CD4 and T cell count of 175 cubic millimeter per liter is at risk of opportunistic infections. Question number 15. Ebola virus is found naturally in which of the following? Option A. Bats, B. Parrots, C. Crow, D. Monkeys. This Ebola virus is commonly associated with the infected bats. This Ebola virus recently attacked Indians in Kerala state, where the infected bats were eating the fruits in a tree, and that fruit was eaten by the human being that spreads. Question number 16. A patient on antipsychotic drug begins to exhibit biaser facial and tongue movements. Based on these findings, the patient is most likely exhibiting signs and symptoms of which disorder? Option A. Acute dystonia. B. Neuroleptic induced Parkinsonism. Option C. Tardive dyskinesia. Option D. Serotonin syndrome. So biaser facial and tongue movements. So in neuroleptic induced Parkinsonism, there will be hyperthermia, and in acute dystonia, there will be muscle stiffness, tardive dyskinesia, and serotonin syndrome. Serotonin syndrome is associated with antidepressant drug side effect. Selective serotonin reuptake inhibitor side effect causes serotonin syndrome. And this is related to option C, tardive dyskinesia, where you can see facial biaser, movements and tongue movements abnormal. Question number 17. The nurse is caring for a patient with glaucoma about activities that can increase intraocular pressure. The nurse should tell the patient to avoid the activities that requires option A, bending from the waist, option B, lifting weights less than 5 kg, option C, moving head side to side, option D, reaching overhead. So here the nurse should instruct the patient to avoid bending from the waist, that may increase the intraocular pressure. Next question. Identify the device in this image. Option A, neonatal phototherapy machine. B, irradiance meter. C, Billy pad LED phototherapy unit. And option D is oxygen FiO2 analyzer. This image shows the device called irradiance meter, phototherapy irradiance meter, which is commonly used in the NICU. Question number 19. Which of these electronic devices aid in critical patient for aid in critical patient from breathing problems? Option A. You have these four images and select the image which will help in patient to assist breathing. So among these four, the C, this is the machine which is going to assist you in the breathing. Question number 20. Which measurement denotes the subject from the heaviest to lightest? So these are the scales of measurement which you see in research book. Which scale of measurement will be evaluating the subject from the heaviest to lightest? A. Nominal scale, B. Ordinal scale, C. Interval scale, and D. Ratio scale. The right answer is option B. Ordinal scale. Question number 21. The sensation of pain that is described most commonly by the patients who suffers from angina is option A, stabbing pain, B, sharp pain, C, heaviness, and D, throbbing pain. So in angina, the pain commonly described by the patient will be heaviness. The characteristic of the pain is heaviness. Question number 22. These are the stages of demographic cycle. Arrange it in a correct order. A. Early expanding stage. B. High stationary stage. C. Late expanding stage. And D is decline stage. And E is low stationary stage. So here option 1 A, B, C, D, E. Option 2 B, A, C, E, D. Option 3 B, A, C, D, E. Option 4 A, C, B, D, E. Option 5 A, C, B, D, E. So arrange the stages according to the demographic cycle. Now let's see the answer. The right answer is option 2 B, A, C, E, D. The stages of demographic cycle includes high stationary stage, early expanding stage, late expanding stage, low stationary stage, and there will be decline stage. Question number 23. The committee which was set up to monitor the general condition of nurses was option A, Board Committee, B, Mukherjee Committee, C, High Power Committee, and D, Mudaliar Committee. So which committee was set up to monitor the general condition of nurse? The right answer is option C, High Power Committee. Question number 24. Malignant tumor of the testis is known as A. Melanoma, B. Seminoma, C. Lymphoma, D. Blastoma. The testis tumor is known as option B. Seminoma. Question number 25. A client with COPD has secondary polycythemia. The nursing diagnosis that would be included in the care plan is option A, impaired tissue perfusion related to thrombosis. Option B, activity intolerance related to dyspnea. Option C, fluid volume deficit related to blood loss. Option D, risk for infection related to suppressed immune response. So in COPD, the primary who the patient who is secondary to polycythemia, the primary nursing diagnosis will be option A, impaired tissue perfusion related to thrombosis. Thrombosis which is associated with polycythemia, and impaired tissue perfusion is also related to COPD. Question number 26. Key signs and symptoms of Bell's palsy includes all except option A, unilateral facial weakness, B, pain around the jaw and affected side. Option C is disorientation to time, place, and person. Option D is inability to close eyes on the affected side. So the Bell's palsy, the key signs and symptom is option, sorry, not option C. Here the answer is pain around the jaw on affected side. This is not option C. Sorry, except. So when it is except, it is right. So here in Bell's palsy, the main signs and symptoms are unilateral facial weakness, pain around the jaws on affected side, and inability to close eyes on the affected side. These three are the signs and symptoms of Bell's palsy. So disorientation to time, place, and person is not a signs and symptom of Bell's palsy. So answer C is right. Question number 27. Which organ is refers to the relay station of the brain? Option A, thalamus, B, hypothalamus, C, pons, and D, cerebellum. The organ which is known as the relay station in the brain is option A, thalamus. Question number 28. A nurse is documenting her care for a client with iron deficiency anemia. Which nursing diagnosis is most appropriate? Option A, impaired gas exchange. Option B, deficient fluid volume. Option C, ineffective airway clearance. Option D, ineffective breathing pattern. So, which is the most common diagnosis related to iron deficiency anemia? The nurse to be documented. The right answer is impaired gaseous exchange because of decreased hemoglobin level. Question number 29. A nurse is administering cyanocobalamin vitamin B12 to a client with pernicious anemia secondary to gastrectomy. Which administration, which route of administration the nurse should use? Option A, topical route. Option B, parenteral route. Option C, enteral route. Option D, transdermal route. The right answer is option B, parenteral route is indicator when you give cyanocobalamin in a client who is having pernicious anemia, who is having secondary to gastrectomy. Question number 30. A client with major abdominal trauma needs an emergency blood transfusion. The client's blood type is AB negative. Of the blood types available, the safest for the blood to administer is option A, AB positive, option B, O positive, option C, B negative, option D, A positive. For a AB negative client, the safest blood can be administered is option C, B negative. Because of this, antibody and this RH. That is why B negative is effective and safest. Question number 31. Takayasu arthritis is also known as option A. Aortic arch syndrome, B. Granulomatosis, C. Temporal arthritis, option D. Idiopathic arthritis. Takayasu arthritis is known as commonly aortic arch syndrome. Question number 32. Diagnostic test result of sickle cell anemia shows all the following except option A, low RBC and elevated WBC. Option B, decreased ESR and increased platelets. Option C, increased serum iron levels. Option D, HB level may be high or normal. So in sickle cell anemia, the diagnostic test will show all the things except means option D, HB level may be high or normal. In anemia, HB level will never be high or normal. All other diagnostic findings are common. Question number 33. ABG analysis of a client with septic shock reveals the following. Option A, respiratory alkalosis, B, respiratory acidosis, option C, metabolic acidosis, and D is metabolic alkalosis. So ABG analysis in a client with septic shock shows that the client is having respiratory alkalosis. Question number 34. Reed-Sternberg cells are the hallmark tumor cells of A. Mantle cell lymphoma, B. Follicular lymphoma, C. Hodgkin's lymphoma, option D. Burkitt's lymphoma. Reed-Sternberg cells are the hallmark tumor cells of option C. Hodgkin's lymphoma. Question number 35. During anaphylaxis reaction, which is the most priority nursing diagnosis in a client? Option A, decreased cardiac output, B, risk for suffocation, C is impaired gas exchange, option D, ineffective airway clearance. So the priority nursing diagnosis in anaphylaxis reaction will be option D, ineffective airway clearance. After that, risk for suffocation is the second priority nursing diagnosis. Because of laryngeal edema, the airway clearances may be present. Question number 36. While receiving blood transfusion, the patient develops chills and headache. What should be the nurse's initial action? Option A. Administer ordered acetaminophen and cover the patient with blanket. Option B. Slow the blood flow. Option C. Notify the physician. And option D. Immediately stop the transfusion. So the right answer, when a patient is having chills and headache while the time of receiving the transfusion, the nurse should immediately what should do means stop the transfusion. Question number 20, 37. During assessing a patient's mental status, patient complains that someone is making conspiracy against him. Which type of delusion is it? Option A, delusion of jealousy, B, delusion of persecution, C, paranoid delusion, and D, delusion of nihilism. So we know that delusion of jealousy, the sexual partners are not faithful to one another. Option B, the delusion of persecution in which somebody is planning against a person. Option C, paranoid delusion is suspiciousness thoughts. Option D, delusion of nihilism, the patient says some of the body parts are missing or some of the body parts are growing longer. So option B is right. Question number 38. Flatulence is relieved by A. Antacids, B. Astringents, C. Carminatives, D. Purgatives. The right answer, flatulence are relieved by carminatives. Question number 39. The father of modern psychology is A. Gerald Kaplan, B. Erikson, C. William Wundt, option D. Sigmund Freud. Modern psychology father is option C. Wilhelm Wundt. Question number 40. In toddlers, which type of accident is found to be more common? Option A. Choking. B. Drowning. C. Poisoning. Option D. Burns. The toddlers, the common accident type is option D. Burns. Question number 41. Down syndrome among newborn is due to option A. Nutritional deficiency. Option B. ABO incompatibility. Option C. Chromosomal errors. And option D. Inborn errors of metabolism. So Down syndrome is commonly due to option C. Chromosomal errors of. This is the common cause of Down syndrome. Question number 42. Most common strain of E. coli giving rise to traveler's diarrhea is A. Enteropathogenic, B. Enterotoxigenic, C. Enteroaggregative, option D. Enteroinvasive. A common strain of E. coli which gives rise to traveler's diarrhea will be option B. Enterotoxigenic. Question number 43. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by A. Dogs, B. Cats, C. Birds, option D. Fish. Histoplasmosis is commonly transmitted to humans by the option D. Fish is right. Uh, so let's check this answer again. Actually, the histoplasmosis is transmitted by fish, not the birds. Question number 44. Which of the following factors should be the primary focus of the nursing management in a client with acute pancreatitis? Option A. Fluid electrolyte balance. B. Management of the hyperglycemia. Option C. Pain and comfort management. Option D. Nutritional management. So acute pancreatitis, the primary focus on nursing management would be fluid and electrolyte balance. Question number 45. What is the first intervention for a patient who is experiencing chest pain and his partial pressure of oxygen is 89%? Option A. Morphine administration. B. Sublingual nitroglycerin administration. Option C. Octane on ECG. And D is oxygen administration. So the first intervention when a patient having chest pain and the partial pressure of oxygen of 89% only means oxygen administration is right. Question number 46. On a follow-up visit after having a vaginal hysterectomy, a 32-year-old patient has decreased hematocrit level. Which of the following complication does this suggest? So the decreased hematocrit level suggests option A hematoma, B hypovolemia, C infection and D pulmonary embolism. So which will be the right answer? The decreased hematocrit level is related to hematoma. Option A is right. Question number 47. A firefighter who has involved in extinguishing a hose fire being treated for smoke inhalation. He developed severe hypoxia 48 hours after the incident, requiring intubation and mechanical ventilation. Which of the following condition has been most likely developed? Option A pneumonia, B bronchitis, C atelectasis, option D acute respiratory distress syndrome. The right answer option D acute respiratory distress syndrome is right. Question number 48. The nurse is preparing to take vital sign in an alert client admitted to hospital with dehydration secondary to vomiting and diarrhea. What is the best method used to assess the client's temperature? Option A oral route, B axillary, option C is radial, and D is heat sensitive tape. So according to some people, they are saying axillary route is the best method to assess the vital sign when the client is having dehydration secondary to vomiting and diarrhea. But here we have option D, heat sensitive tape. When heat sensitive tape is not in the option, you can go for axillary because heat sensitive tape is very comfortable and it reads accurate than the axillary. When axillary is present without heat sensitive tape, go for axillary. Question number 49. A 34-year-old woman who developed Stevens-Johnson syndrome while undergoing treatment with carbamazepine tecatrol is being transferred to stable condition from the intensive care unit to the medical unit. These are four beds available. The nurse knows that the best choice of roommates for this client is which of the following? Option A, a 40-year-old man with methicillin-resistant Staphylococcus aureus. Option B, a 28-year-old woman diagnosed with diarrhea. Option C, a 72-year-old man with fever of unknown origin. Option D, a 68-year-old woman with atrial fibrillation. So, which room the for the patient who has Stevenson Johnson syndrome who is undergoing this therapy? So, with which patient's bed he can share the room? So, basically, option 4, the 68-year-old woman with atrial fibrillation is right. Why means all other three are related to the infection can be contagious and it can be transmitted. In Stevens Johnson syndrome, the patient's skin integrity is questionable. So easily from other three patients they can get the infection, but the atrial fibrillation is not a contagious and transmitted disease. So the patient can share the room with atrial fibrillation patient. So this is the rationale for question number 49. At last, the 50th question. The answer you have to give in the comment box. It is a subscriber challenge question. Positive Kernick sign is observed in A. Cholecystitis, B. Appendicitis, C. Nephritis, D. Meningitis. Write the answer in the comment box below the video. This is the end of the 50 questions video. Thanks for watching. Hope you enjoyed these 50 questions and wish you all the best for the BHU nursing officer exam. Meet you again with another good 50 questions. Till then, take care. Meet you all soon. Bye bye.